Hello, this is Dr. Sean McWilliams from Disc Centers of America in Alpharetta bringing you another video. And today what I want to talk to you about is how to understand and read your MRI report. I know that it can be a very stressful time anytime that someone sends you for an MRI, because normally when you're getting imaging of that type of quality and magnitude, some doctor in your life is trying to look for something very specific. So what I'd like to do is I'd like to explain to you a little bit, especially because we specialize in spine and disc type diseases. When you read your spinal MRI, or if you read that report, I'd like to give you some of the vocabulary words that can be a little bit confusing and how to understand those in English. So one of the very first things I'd like to do is I'd like to show you a little bit about normal anatomy. And that basically means just what we're supposed to look like on the inside. So let me grab a model and let me show you this. Okay, so when it comes to the human spine is made up of 24 different bones. And there's a few parts to the bones when you look at them. If you look at the front part right here, this is called the vertebral body. It's the big part that bears a tremendous amount of weight for us. You have the thing in between that's called the intervertebral disc. So if you heard of someone herniating disc or bulging a disc or slipping a disc, that's that structure they're talking about right there. I'll show you some more detailed ones in a minute. The other thing you can see in the back is a thing called the facet joints. These are the facet joints right here, and the facet joints is what actually allows the spinal column to glide and move with each other. And these are joints, and they are supposed to move. The other thing that you're going to look for is a thing called your spinal cord. The spinal cord is a long tail off of the base of the brain. It is the same type of tissue as your brain, so it is central nervous system tissue. And that spinal cord has to run down through a little tunnel in the inside of 24 movable bones that protect it from damage. Around the spinal cord that you can't see in here is a fat layer. It's called the thecal sac, but you can see it very clearly on an MRI. The other things that we want to look for is we want to look at the spinal nerve branches. You have 31 pairs of these branches that branch off at every single level of your spine. This is just an example of 2 of those types of branches, but you have 31 of those that go down. So when everything's functioning properly, the bones should have a nice smooth shape to them, the disc should be nice and thick, there should be proper motion between the segments. That's actually what keeps the disc healthy. It's called a process called imbibition. It's just like a sponge you wash dishes with. You put it into water, it soaks up water, you wring it out, it pushes the water out. Your body is naturally designed to do that process of this milking or pumping mechanism. When everything continues to work like that, things usually stay very healthy for you. I'll show you on another model here what can start to take place if you lose the ability of the segments of your spine to move properly, and what can happen to the disc. So when you read your MRI, you have a better idea. So when you first look at this model, this is a model of a healthy spinal column, and just a couple of basics we want to look for. Number one is that the front of the bone should have a very nice smooth shape to them. It means there's no arthritic spurs, usually means the bones are very healthy. And when we look at these structures right here called the intervertebral disc, they're nice and thick. And really one of the major jobs of that disc is not only to support some of the weight of your body, but it's allowed to have you allowed to have motion in the spinal column and act as a spacer or a shim so that the bones can get pushed apart far enough so that that hole right here where that nerve can come out is big enough so that there's no pinching or pressure on that nerve. So that's the way it's supposed to work. Now, if you start to lose mobility of your spinal column, what's going to eventually start to happen over typically about 5-year process is the discs aren't going to get proper blood supply and oxygenation to them, and they're going to start to become in a state of disease. And what that starts to look like is this next model. And so if you look at this comparison model, you'll see when we're healthy, the discs are nice and thick. When they start to become diseased, they actually start to get slightly thinner. And that thinning process is a problem. And if you look at it on an MRI, what you can start to see is perhaps the radiologist will call it desiccation of a disc. And desiccation is a big fancy medical term meaning that the disc is starting to become dehydrated, that the pumping mechanism, the ability for the bones to move with themselves is not functioning properly, and as a result, the disc is not getting adequate blood supply in and out of it. There's one major problem when it comes to healing discs, is that discs have the worst blood supply of any part of the human body. The very outer part of the disc has a thing called the sinovertebral artery. It does supply the very outer 1/3 border of the disc with blood supply and oxygen, but the rest of the disc, which is the majority of it, is actually getting its blood supply, oxygenation, and nutrients through the bone marrow. There are marrow canals that run up through the bone marrow and go to the disc, and when those vertebrae go through this pumping mechanism, it actually pushes blood up into the disc and tries to retract it, and that's how the cells continue their metabolism. So if we're starting to lose disc height, we know that process isn't happening well. If that process goes on for another 5 to 15 years, you'll start to see major changes occur then. And I'm going to show you what that looks like. So typically moving on from a 5-year process to a 10 to 15-year process, now is when you really start to see changes. If you have x-rays of your spine, typically you're going to start to see osteophytic spurs, which are bone spurs. It is a short-term strategy that the intelligence in your body does to try to stabilize a stressed or weakened area. Short-term, it's good. Long-term, unfortunately, it's lethal, because if you don't change the biomechanics of the spine, the bones will have a tendency to continue to grow more bone, and basically what they're going to try to do is try to weld themselves together, which is not good for our bodies. So if you also look between phase 1 and phase 2, we've typically lost somewhere around 30 to 40% of the disc height, and that's where we start running into a lot of issues at. Normally when that starts to occur, the outer parts of the disc, called the annulus fibrosus, is these very strong outer rings that are all supposed to be intact, typically start to get tears in them called annular fissures or annular tears, and this inner part of the disc that's called the nucleus pulposus starts to push out, almost like jelly getting pushed out of a jelly donut to the outside. What you're seeing right here is what's considered a disc bulge with annular tears to them. That means that the inner nucleus or jelly is not pushing all the way out. So if you hear the term disc bulge, that's usually what they're talking about. I'll show you on another model what that looks like in a second as well. If the disc continues to be diseased where that inner jelly pushes all the way out, that's more of what you're seeing right there. That's going to be called a herniation of a disc without getting too complicated about it. I'll show you on this other model because it's a great model to show this as well. So if we go back to this big model right here, you can see it really well. So normally when you have a healthy disc, the disc size should be the exact same size as the bone above and below. If you have a disc bulge, which means the outer rings of the disc are getting damaged, they can't contain the pressure of the inside jelly, then what starts to take place is this disc is going to start to push out like that. That's called a disc bulge. So if you see that term on your MRI report, that's what's happening inside. If you see the terms protrusion or herniation, technically they are the same thing, except a protrusion describes it a little bit more in detail than a herniation. That basically means is that the inner jelly that was on the inside the nucleus has now gone outside of the disc. So if you watch this, you'll be able to see how that disc material can start to push out. And the problem is when it does that, it unfortunately usually can only go into one of two areas. It's either going to go into the area where the spinal cord sits around in the thecal sac, and sometimes it'll push into the thecal sac and create a thing called central canal stenosis. And what that basically means is that that tunnel where your spinal cord is trying to get through, which should be nice and big, is now becoming smaller because you have disc material pushing into that area. Sometimes they'll say that there's indentation of the thecal sac or the spinal cord. What that means is that that inner nuclear material that just squeezed out, what you just saw, is actually starting to push onto the spinal cord and deform the shape of the spinal cord, which is not what we want. The other thing that can happen is that disc material can start to push out into these areas right here. These areas are called the lateral recesses, and the lateral recesses is a big fancy term for where this basically the nerve branches sit into a little tunnel where those nerves can come out. So most of the time when a disc bulges or herniates, what you're going to see is you're usually going to see it happening out in this area or this area because there's a very strong ligament that sits right in the middle of the back of it that usually keeps it intact. If that ligament gets damaged, called the posterior longitudinal ligament, then you can start to press on the spinal cord, which we don't want. So those are some of the terms you're typically going to see. What I'd like to do is I'd like to show you the difference when you hear the term desiccation and you look at your MRI. When you look at an MRI and you're looking at your discs on an MRI, they should be a light gray color, especially on what's called a T2 weighted image. T2 weighted image, when you get your MRI done, you'll sometimes see the terms T1 and T2. T2 usually lets you see it a little bit clearer because everything that has high water content, which is our discs are almost 80% water, the spinal cord and the thecal sac, the fat around it has high levels of water, they're going to show up usually very white, bright, or very light gray. So when you look at your MRI, you should see when you look at the discs, they should be nice and light and gray color. That usually means they're nice and healthy, like this one is. If they lose the ability to get blood supply in and out of them, which is called desiccation of the disc, then the discs start to become much darker on an MRI and you'll actually see it. So if you're looking at your MRI and you're seeing discs that actually look very dark to black, that means that that disc is not getting blood supply in and out of it, it's not getting oxygen into the tissues, and it's changing its metabolism from an aerobic activity, which means with oxygen, which is how it's supposed to be, to an anaerobic activity, which means that its metabolism is happening with less oxygen or no oxygen. And unfortunately, the process of that is lactic acid, which means the disc is actually making its own acid within itself and actually starting to almost eat itself away from the inside out. So those are some of the major terms that you're going to see on your MRI. Now, with all that stuff being said, I want to shed some positive light on this for you. At Disc Centers of America around the country, and specifically here in Alpharetta, we have some really incredible tools to help try to reduce and stop this process for you and try to get your disc to become healthy. We really want to stop the process of it being an anaerobic activity and get highly oxygenated blood into the disc. We do use a very few special tools like hyperbaric oxygen therapy to help super infuse the disc with blood. We use cold lasers, which help us bring more blood into the disc so that the disc will start to heal itself from the inside out and produce more cellular energy called ATP. And the third thing we do is we use computerized spinal decompression tables to actually very gently create more space and start to create this pumping mechanism again to start to get these discs to be hydrated from the inside out versus just putting a Band-Aid on it using steroid injections and some surgery. So if you're suffering with disc issues, if you have bulging discs, slip discs, herniated discs, protruded discs, disc extrusions, or sequestered discs, please call my office. We always offer a complimentary consultation to our patients. I will give you a second opinion on your MRI at my expense, and I will go over and review that with you. And if I honestly think that I can help you, I will give you my recommendations on what you can do. So please remain hopeful. I know sometimes it can be a very daunting task when your back is killing you and it's really affecting the quality of your life, but I don't want you to give up, and I want you to know there are other resources, and that's what we specialize in. I have 4 national certifications in spinal decompression. I'm also board certified in it as well. I'm certified in hyperbaric oxygen therapy. I've been doing it for over 20 years. Give us a call. Come talk to me. We'll get you in right away and see if we can shine some light on this and give you some hope. If you have any questions, please write a comment below. If you feel like this has been helpful, please like this video and like our channel and subscribe to our channel. And if you push on the little button that looks like a bell down there, you'll get notifications anytime that I do a new video to help improve the quality of your life. Until next time, this is Dr. Sean McWilliams. We want to help you get back to the quality of life that you deserve to have. So please give us a call and let's see if we can help you naturally.